There was a lot of chaos when I was younger and just eating the wrong things, never exercising. So I started battling my weight at a young age. I'm Craig from Dover, New Hampshire, and I came into Portsmouth Regional Hospital to get bariatric surgery. So I've lost a total of 208 pounds. I was shooting for 218 because I wanted to lose half my body weight, just because I'm competitive like that.
After bariatric surgery, you can expect to lose between 60 and 70% of your excess weight. And you can expect that the vast majority of patients are going to keep that off for the long term. And more importantly than just the weight loss, you can expect that other medical issues related to obesity like diabetes, high blood pressure, high cholesterol, sleep apnea, those are all going to significantly improve or in many cases resolve completely.
Probably 5 or 6 years ago, I looked into the surgery here at Portsmouth Hospital. Went to the informational session, but I didn't have the support at home at the time, so I knew without the support I was probably not going to be successful.
When I met Craig, I just thought he was amazing, but I know that the weight was an issue. He had high blood pressure, he had sleep apnea, but he was very active, and we did a lot of things together. To me, support is everything. And I told him, if this is something you decide to do, you're the type of person that can do it.
One of the consistent messages that we try and send is that surgery alone is not going to provide long-term success. You'll lose some weight, absolutely, but you're going to put it back on if you don't have the tools and the habits in place for long-term success.
Cassie told me, you want to see doctors that can do surgeries in their sleep, and that's pretty much what Dr. Benedetto told me. He said, I've done 2,500 of these in my sleep. I'm like, well, this is the right place to be.
Any program is going to have a surgeon that can do the operation and do it well, but not every program is going to have a dedicated team from Jess down to the nurse practitioners to the nutritionists to everybody that works with the patients who really care about how our patients do.
2 weeks prior, you start a liquid diet. Then you go in for your surgery. 2 weeks later, you're doing a liquid diet. So basically a month on a liquid diet. And then slowly they build you back up to start and eat solid foods. But going through it and actually learning about the process and everything they ask you to do and giving you that roadmap, a lot of the negative stuff I was hearing was because people weren't following the protocol. They were eating excess fat, excess sugar. They were doing all the wrong things. They were going back to their old ways.
I noticed a dramatic shift in the way he thought about himself and how he presented himself to other people. And it made me smile every day because he had more confidence in who he was and what he was wearing. We're getting married in November, and then we're gonna enjoy life.
I think a lot of times people struggle for so long, they think that things can never change, but they really can, and we change people's lives every day.
My dad, he had a bad heart attack in his late 40s. That was in the back of my head all the time that, could be around the corner. I believe Portsmouth Regional Hospital and Dr. Benedetto and his whole team pretty much saved my life.